And for patients, it's a very positive experience. It's empowering, they become more involved. There's certainly a sense of engagement when we get feedback from them, and certainly there's objective evidence that there's increased patient satisfaction.
The way we start this off with when the patients join our surgery, when they register, we just show them what this is their problem list, make sure that they're happy with what's written there. If they have any questions, they're welcome to ask. And that's a good point because that's like a new beginning when they join our surgery.
It makes everything feel more streamlined, and the feedback I've had from patients is that it has been helpful for them.
Now we've also got the detailed coding information being available to the patients. They're getting further involved as well. So it's a gradual process.
Our discussions with patients, when they have more access to information, tend to be more focused and probably more productive. So overall, we're very big advocates of online services.
Some practices have found that the whole process quite challenging. Often the registration process is seen as complex, and looking at ways at which we can encourage patients to sign up for services.
The way things are going in terms of information technology and what patients usually expect to be out there, the patient access system simply just makes it happen.
Again, there's been a lot of variation between practices. We've been working very hard with individual practices and with CCGs, local facilitators, to try and make the process as simple as possible, to understand the challenges and to work with them to develop innovative ideas around the adoption.
I think the social media campaign and London campaign from HLP and also our local campaign in social media, I hope it will do the trick, and it will be very helpful to make a push from the patients, because patients are customers.
So if we look at the number of patients registered for these services, the initial target was for practice to have 10% of patients registered for any of the online services. The target for that was 31st of March this year, and at a regional level we've achieved that, although some practices haven't quite met that target. And we're now setting a stretch target of 20% of patients to be registered for services within the next few months.
We should really work now on patients using those services, I think. Not pushing anyone, because we cannot push anyone. If someone wants to phone the practice and they can get through, obviously they'll phone the practice. But I think it's the time when we reached in Wandsworth certain saturation levels, so instead of pushing them, it should be a pull from the patient end.
It's also into the point where I feel as though the patient awareness of digitisation in healthcare is becoming more acceptable, and the feedback we're getting from patients is overwhelmingly positive.
And what we're trying to do with digital is to offer alternative ways of people to receive health services. The face-to-face model is what everybody's used to, but other industries have already used and adopted a range of digital services. So things like online banking, a lot of us already use those services. And Patient Online is just the first steps, the baby steps from the NHS moving into that world.